Hello. Since today's guest is from By the Lake Massage, I thought, why not literally start by the lake? Today I'm at By the Lake Massage here in Port Credit, Mississauga. I have a massage appointment with an awesome therapist named Sheila, and we're going to do a bit of an interview with her. So, come on, come with me. By saying your name and what you do, how long you've been here for.
Okay, so my name is Sheila Afonso Burnay, and we're here at By the Lake Massage Therapy in Port Credit. I'm a massage therapist, a registered massage therapist, a Zen Shiatsu therapist, and a yoga teacher. And I've been doing that for a massage therapy for about the past 2 and a little bit years, but I've been working with yoga and body work for more than 20 years.
What got you into this kind of work? Was there a moment where it just clicked for you?
So I jokingly say that it kind of chose me. I never really thought that I would do this. A lot of people have dreams about what they want to do or foresee, like this is a life dream. For me, it was kind of, maybe somebody told me once, like, oh, you should be a yoga teacher. You have a really good voice or something like that. And I just thought, okay, maybe I can try that. Yeah, and things kind of just lined up in a way that I just ended up choosing this. I don't live life in a way that I kind of predict or plan things. I kind of allow life to instruct me, and I follow the path.
How would you describe your style or vibe as a massage therapist?
Ooh, that's a good question. So I try to be very attentive to the client and have a very client-centered approach, always interviewing the person before they come in, even if I've seen them multiple times, asking them how they feel that day and trying to really take in how they feel, how they look, how they sound, and asking them if there's any issues, and really having that be the center of where I start from. And I try as much as possible to make people feel comfortable, listened to, seen. And I always encourage people to speak to me during the treatment, not to have conversation, but if they're feeling something, it doesn't feel right, or they want more pressure, less pressure, something doesn't feel right, I remind them always to tell me so that we can kind of align the treatment so that they leave feeling better. So that's what I try to do. And I feel like it's pretty organic. It's maybe not every massage therapist, every therapist has their own language, their own personality, their way of treating. And I guess I have mine too. It's very organic. It's very flowing and a big focus on the breath. Yeah.
What do you love most about the work you do here at By the Lake Massage?
So I really love the people that are here. I feel like that's very important when you work somewhere. You need to feel comfortable. You need to feel as if you're in a community, that you're supported. And there's definitely a sense of that here. And we also have Goliath, which is our little dog, and that makes a big difference. I think people love it when they come here and see an animal here. He definitely helps us in our work. And of course, making people feel better, helping people, to feel good in their bodies, to love themselves. I think that's a great thing. And I think I'm a little bit of a selfish therapist, maybe. I think the Shiatsu has taught me this, that when I'm giving to somebody, I'm also receiving. So it's a two-way street. I feel like there's a collective energy that is created within the treatment, within the room, and I get to partake in that in a very conscious, very just a good way, So yeah, it's a little bit selfish. How are you feeling today?
I'm okay. I'm feeling hot, like hot weather out.
Are you having any pains, any issues, anything that you want me to pay attention to today in the treatment?
I'm feeling a bit of a pain here and maybe here, but more so here. And it feels even swollen. I don't know if there's such thing as a bruised rib. It just feels a little tender.
And
I don't know
did
if
you
it's
do something?
from yoga or bike riding, but it just feels like a little bit of a pain. Like it just when I do that, not when I'm
Okay. And how many days have you been feeling that?
a few days.
Okay. And does it feel pain? Which kind of movement elicits that pain? Twisting motion?
It's more so if I just do that.
Okay. So this is a sensitive area, meaning that we, as a therapist, we can't work on that area unless you give us verbal consent and written consent. So if you're okay with that, then we can do some work over that area. You're okay with that?
Yes, I'm giving verbal consent.
Okay, perfect. And then after the treatment, I'll get you to sign the paper. Okay. Anything else that you want me to pay attention to?
As I normally say when I come here, focus on me. I'm always appreciative of what you do.
Okay, perfect.
All right.
So like I always tell you, if you want more pressure, less pressure, something doesn't feel right, just let me know. You're going to get onto the table belly down in between the sheets, and I'll knock when I'm ready to come back in to make sure that you're fully covered, right?
All right. Thank you.
Is it too warm with the blanket?
Nope.
We'll start with a few deep breaths. You're okay if I touch over the sacrum and the glutes?
Yep.
Were you doing like some back bending poses in the yoga? Maybe that's why you press the ribs into the yoga mat too much.
I'm
Do
not
you
even.
remember like bow pose?
I'm not even 100% sure if it's from that or not. But the only thing I have done recently has been bike riding and a couple yoga classes. Yes. What are you noticing as you work on me? Anything common or, surprising?
So when I'm doing this kind of pressing in the beginning of the treatment, my hands are almost kind of like reading the body, right? Trying to understand which areas are softer, which ones are harder, So I notice like along the spine that there's some areas that are a little bit harder, tense. In the shins, the hamstrings are tight. So then it kind of gives me like a roadmap, right? So that I can, in the treatment, focus on those areas a little bit more. And then I integrate some acupressure on the feet. I come back here to the back and try to give the body like a little boost before I work, like with the massage or with more acupressure, so that the body kind of opens up a little bit. And it kind of just helps the person to just relax and come into their breath. So I'm just holding some points on the lower back, which are usually soft for most people. And when it's soft, it indicates to me that maybe there's a little bit of deficiency, like a lack of energy. So then it's almost like gasoline. I'm telling the body to bring the attention to this point and to kind of absorb some energy, move the energy to this point. And usually if the person can be still enough and open enough to that, it's pretty soothing and grounding. For some people that their mind is very fast or they have a very fixed idea about what the massage should be, then it can be a little frustrating or, unnerving. So that's why, I like to explain to the person what they can expect so their mind can get there first and then their body will get there. Because the way I work is a little bit different from other people, right? So we're going to start with the oil on the back.
This question wasn't on my list, but it's a bonus question.
Okay, I like bonus questions.
Conversation during massages. I mean, I've had the pleasure of being a client of yours for a long time, so I feel we have sort of this vibe that we kind of know when to talk, know when to not talk, or you kind of know when to kind of let me kind of chill versus talk, or vice versa. I don't know what I'm trying to say if I'm making sense, but I guess the first question is, what's your maybe preference? Do you like talking to the clients, or do you like it to be quiet, or what's generally, I don't know.
So, I try to always remember that I am here. This is my job. This is my service that I give to somebody, right? And so the client comes first and foremost. So it's not really about me, right? I don't do what I prefer. I do in my work what I prefer because that's my skill set and I have to do what feels right to me. within all of the guidelines of safety and ethics, right? But when it comes to speaking, I just take the person's lead, right? If somebody starts speaking to me, then I'll engage in conversation with them. And if somebody's quiet, then I also just remain quiet. Because it's about them, it's not about me, right? And some people, some people say that the massage table is like the new bar. People used to go to the bar to talk to the bartender and let off some steam, talk about their life, their problems. So some people come here and they want to talk about things, and it's fine. And everything is confidential. People know that when they come here, what they say, we don't repeat to anyone, and it doesn't leave the room. And most of the times, we just forget. We do so many treatments in 1 week that it's impossible for us to remember everything. So, yeah, I just try to follow each client's lead. And really, the truth is, when I speak to my friends or to people that find out that I'm a massage therapist, a lot of times they say, I wish my massage therapist would just shut up. So lots of times, that's why I think people come here to rest their mind, to relax. Sometimes out of they feel like they want to be polite, then they're talking, right? But it's not about me. I don't need people this is my work, right? I don't need people to please me. I'm here to work and to do my best. So then I try to keep that in the forefront, that most people hate it when massage therapists are talking. Like many of my best friends will tell me, oh, I love my massage therapist, but she just won't shut up, or he, so
But there's something
I think this is a very common thing, even for myself. A lot of times I go for treatments, and the majority of the times, I'll say 95% of the times, I don't want to talk. I'm trying to feel my body. I'm trying to move the energy with my breath, to be conscious, because I know the more I focus on my body and on my breath, the more the treatment can be effective. But sometimes talking is part of that. Sometimes you need to let something out. Sometimes you work through something with the therapist, because you already know them. So it's very personal,
The one thing I will shout out you and all the great staff here is that I feel Bida Lake Massage seems to have that perfect balance.
Yeah.
Because I do know, I won't name names, but massage studios and massage therapists that either it's completely on, talk, 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 or literally no conversation at all. But you and Spencer and Aaron, all the staff here, just seem to have that perfect balance.
It's good.
Yeah. Now, Sheila, how do you stay grounded or present while working on so many clients every day?
I really try my best to do that. It really depends on my mental state also. I can admit that there's some days that maybe I'm not as focused as others, but I have things that I do every morning and things that I do between each treatment that helps me to clear energy and to focus my energy and my intention every day. So yeah. And I think it's also about honoring the person that's on the table. Like I wouldn't want somebody to be touching me and thinking about a million other things. I know it happens, but I think the person can feel through my hands what's happening in my brain. You know? So you can feel if somebody is touching you with intention, if they're feeling what's happening with your body, or if they're just doing a skim over, you know? So it's kind of like watching a movie and being attentive versus watching a movie, scrolling on your phone, doing your grocery list. You know, how attentive are you to what you are doing at the moment? So I try my best to be as present as possible. And I think, you know, if people keep coming back, something is working, you know, something is authentic and they can feel that I'm present. Yeah. And also the rhythm with which I work is quite slow, probably compared to other therapists. So because it's so slow, then it's also easier to be present. You know, I'm not jumping. So, you know, same thing if you're speaking slowly or walking slowly, you're more attentive, you're more alert.
What is one thing you absolutely love about your job? What's the one thing you really enjoy about your job?
Okay. So I guess the satisfaction of, you know, knowing that I was able to help somebody, whether it's physically, emotionally, spiritually, you know, that they were able to feel that I connected with them and that we were able to work things. Because it's not, I don't feel that it's me. It's not only me. It's like a two-person engagement. You know, the client has to do just as much work as I am doing through their breath, through their attention, to make the treatment a success. Even in their communication with me, telling me what is working, what is not working. So when something works and when it's successful, it's very gratifying. You know, and being able to every single day connect with so many, you know, really great people. Like we're very lucky. The people that come to this clinic are, a lot of them, very amazing people. So we get to have conversations with them. We get to learn about their life, their families. And it's really nice, right? You get to be part of somebody's life and a positive part of their life. You know, it's a little bit different than being a dentist. So yeah, it's nice. Feels good.
I know many people that are watching this interview right now have never had a massage appointment before, maybe because they're shy or they don't know what to do or they don't know what to ask or what not to ask, the fear of the unknown. What would you advise a person going to a massage studio for the first time that either has never been to a massage studio before or maybe has went to many because, you know, everyone has different ways of doing things? Example, like some massage studios, you know, they want the client to always have a bikini on or shorts. Some are completely fine and encourage the opposite. Like, what would be good questions to ask a massage therapist before their first appointment?
So I think that you can kind of gauge a person's professionalism by how they listen and how they engage with the client. How much time do they take to make you feel comfortable, to make sure that, all of your doubts are, covered and clear. Even if they ask you, some people don't even ask you, is this your first massage treatment? So I try to, if it's a first time client, maybe they've had massage in other places, maybe not. But that's one of the questions on our health history form that people have to fill out before coming for the treatment is this your first time? So the therapist has to look at that and conduct the initial interview before the treatment accordingly. So always in life, communication is crucial, right? But as a professional person, the therapist has the responsibility to create a safe space and hold that space for the client so that they feel comfortable asking all the questions that they have, asking the client, do you have any more questions? Do you have questions for me? Do you feel comfortable? Are there any areas of the body that you don't want touched? So a thorough interview in the beginning of the treatment is very important, stating what you want to get out of the treatment, if there's any areas you would like specifically worked on, any areas that you don't feel comfortable being worked on. All those things you can tell your therapist, any conditions, medications, injuries. And the therapist also has to be very sensitive, Lots of people have had traumatic experiences in their life, so it doesn't mean that that person has to divulge that information. But making somebody feel comfortable, they can at least, create the boundaries around the treatment for them to enjoy the treatment as much as possible. So I feel like each person has a responsibility, right? But the therapist is in a position of power because they're the professional person. So they have to kind of conduct and guide the person so that they feel seen, feel comfortable, and feel able to express what they want in that moment. So there is a power differential in everything in life. And, obviously, on the massage table, somebody is in a very vulnerable position. So it's important to do as much as possible to make the person feel safe, comfortable, and not judged. Sometimes some people can feel judged that, oh, I'm telling this person that I don't like what they're doing, or I don't like the pressure, or I don't like being touched on this part of my body. So when somebody expresses that, or expresses anything that doesn't make them feel comfortable, that the therapist tries to receive that information as openly and as neutrally as possible, because this is a relationship also. The relationship between client and therapist is a relationship, and it needs to be navigated. It needs to be treated with care and attention. I think it also comes back to putting yourself in that person's position, because sometimes you get into that loop of like, oh, I've done massage so many times, I've received massage so many times, then I just assume that everybody feels comfortable, everybody understands what's happening. And that's not the case. You can't assume anything. So always trying to understand at each person's position is very important, right? Okay, when you're ready, lifting both hips so I can remove the abdominal pillow. So when you're ready, I'm going to ask you to roll over and slide down so that your head is resting on the table. Perfect. And a big breath in and out. And big breath in. And big breath in and out.
What should a client do before coming to a massage?
So it's a good idea to maybe not eat anything too heavy before the treatment. So just like a light snack so that you're not hungry, but you're also not stuffed. Big breath in and out. Big breath in and out. And big breath in and out. And then usually in my way of seeing things, massage is a very energetic process, meaning that lots of things are moving, your body is trying to balance itself. And when we take a shower is like cleansing energetically. It resets our body and our spirit and our energy. So I like to do that before I come for a treatment, so that after the treatment, you don't need to take a shower. You can allow everything to settle into the body and then maybe take a shower on the next day. And also being considerate that somebody is going to be touching your body, right? So to be clean and, have good hygiene so that it's, also a person is not feeling self-conscious.
That's interesting about the not showering after a treatment.
Mm-hmm. So in shiatsu, we normally say that because shiatsu is a very energetic kind of treatment and body work. But I feel that massage is the same thing. There's a lot of things happening that maybe we're not even conscious of. So if you really value the process and the money that you're spending on it, you're not going to go and wash away the process, right? Or the work that's been done. So here we're just doing a little bit of stretches to complement the treatment, open up the body a little bit. And the client is always well draped, so none of the sensitive areas are being exposed.
What I know about you, Sheila, you and social media, you're not a huge fan of it. You're not really about it. But I have to compliment you. You're just like owning this interview. You're like an influencer. Like obviously this is your job and you're a professional, but you and the camera, like you just seem very comfortable.
Thank you, Trevor. I think when you love what you do and you feel comfortable, I think when you're an authentic person, no matter with who you are, where you are, your real self will always shine through. Obviously, we all have our insecurities and, we try to be ourselves, but there's always little things, but I try as much as possible to be the same person in everywhere and with everyone in my life the same. And for me, it's important that the message and the information that we're trying to, to share with people, because it's exactly what you said. There's many people that maybe feel nervous. It is a very vulnerable position to be in. But I think that the benefit, if you can get yourself there, the benefit is so wonderful, right? Especially for young people. I feel like there are a lot of young people that are coming for massage now, and this is such an amazing thing, because people can be in touch with their body. They can begin to associate, what is, or understand what is healthy touch, what are boundaries, what feels good, what do I feel comfortable with, what do I not feel comfortable with, communicating and saying what you want, what you don't want without a fear of being judged. So it's all excellent skills for people, young people to grow up with, right? Or any person, but imagine if we could have begun doing massage when we were teenagers or even children, how much we would learn, right? It would be an amazing thing. But we do massage here to babies, to children, even teenagers. So there is a new current, because parents that receive massage know the benefits and they want their children to also experience that and have that as they grow. You know, our body is such a wonderful, miraculous thing. And it's wonderful for us to feel safe in it, to feel joy, and to feel good in all, you know, and to feel in control and to feel, I think the safety is the one very good, important value. To feel in control of those moments.
I found that interesting what you just shared, because I remember a conversation I had with my father a while back, and I think I was just telling him about my day, and I said, "Oh yeah, I had a massage appointment earlier." Right away, he was like, "Is everything okay? How'd you throw out your back? Like, what's wrong?" And I said, "Dad, nothing's wrong." And he just looked at me. He's like, "Why did you go for a massage then?"
Yes.
And I just thought, like, because I can. I have great benefits. It makes me feel great. Yeah. Like, and he just looked at me like I was an alien. Yeah. Like, so do you think that's a generational thing, that like now, or every generation now, is just really about self-care? Or do you think massage therapy has evolved? Because my father was a very blue-collar factory guy, warehouse guy. You know, he just looked at me like, why are you getting a massage? You know?
Mm-hmm. I think, you know, it's the analogy that comes to mind is like, you don't always go to a restaurant just because your fridge is empty or because you have a celebration. You know, you can go for those reasons, but sometimes you go because you just want to treat yourself, right? You want to have the joy and the pleasure of that good food. And I think that massage is the same. People think, oh, I'm only going to go for a massage because I had an injury. Some people are like that, and that's okay. But there's people that come when they have an injury, when they want to, you know, it's part of their routine. They come once a week, once a month, and it's a part of the way that they care for themselves, right? And I think, yes, definitely what you're saying about the newer generation, they value themselves more. They understand that this is part of the self-care process. I think also insurance helps a lot. A lot of people have insurance now that maybe in those parents' generation that didn't exist. So it's a mix of many things. I also have people from older, like our parents' generation and older, that come. But yes, I feel like maybe the younger generation is more okay with giving themselves something that's a little bit more frivolous. But it's not really frivolous. To me, I think it's a necessity. It's just a matter of what you value. Because I don't feel like massage is frivolous, but like especially people that their work is very physical, it's almost like doing a car maintenance, you know. For me, getting a massage once a week is a necessity because I use my body so much. But even people that use their mind so much, massage is just as beneficial for the mind. You know, taking a break and making that gesture to yourself that, yes, you're worth this time, you're worth this money. I think it's a very big symbol to ourselves, you know. And we're kind of stepping away from this kind of totalitarian way of seeing things, you know, that life is work, home, and family, right? There's so much more happening. And I feel like the younger generation is much more aware of these kind of things, of energy, of self-care. I feel like, the younger generation, before, people wouldn't talk about energy, they wouldn't talk about even semi-precious stones or any different kinds of therapies. And I feel like now young people are like, they know about all those things. So there definitely is a shift, which is, I think, great, right? I think it's wonderful for people to recognize that our body is not just bricks and mortar, it's not just material stuff. There's something that animates all of this. And what is that animation made out of? That spirit, that energy, the personality, the soul that lives within the house. And you need to feed that. It's not enough just to go to work and come home.
So if it was up to me, I would love to get a massage every day. But in your professional opinion, how often should a client get a massage? Putting the fact of money, benefits, all that aside, in theory,
If in the ideal world you could get massage as many times as you want, what is the ideal amount? I would say once a week. That's how often I get massaged. And even, I didn't receive massage once a week last year. But when I began to wrap my mind around this idea that that money invested in myself is totally worth it, I had this like explosion of like fireworks inside my heart. When I actually had that idea, I was lying on the massage table and I thought to myself, what if I got massage once a week? And then there was fireworks. And it was like, yes, you deserve that. And yes, it is possible. If you want that, if you prioritize that, and it just felt so right. I think the fireworks was like hitting the nail on the head, saying that, yes, that's right. That's what's right for you. And that yes, you deserve that. It really made me feel like a queen, like you are a queen and you deserve to have that. It was such a fun and exciting moment for me. So I do try my best to have a treatment every week. And not only massage, I try to do other things during the week that I know help me to be balanced and things that help to feed my body and soul, like exercise, like meditation and prayer. So it's kind of fine-tuning your life so that your energy and time can be dedicated to everything that you need to have time for, right? To create that good balance. So we usually finish the treatment with working on the head, neck, and shoulders. And unfortunately, because usually people want us to work on the full body, it's kind of gets left for the last and the least time. But one of the things that I'm trying to work on as a therapist, because I know that this area of the body needs so much attention, is trying to balance the treatment in a way that I have a good chunk of time at the end to work thoroughly on the head, neck, and shoulders. Because our society and our lifestyle habits focus a lot on thinking, and a lot of the energy is very much in the top of the body, in the heart and in the brain. So then where energy is and where the intention goes is where the energy will be. So lots of times people have a lot of tension and, tightness around this part of the body. So it's really necessary to work thoroughly and give a lot of attention to this area. So I try to reserve on the minimum 10 minutes at the end of the treatment to work on this area of the body. But ideally, 15 to 20 minutes is really, because it's not a big part of the body, but it's 15-20 minutes allows the person to feel a good amount of relaxation and releasing of the muscles and to feel satisfied.
When you work with a client, can you tell if someone gets massage often versus not? Like, other than the fact that you worked with the client, you know the past appointments, but maybe if you worked with someone that's maybe when with other, like, when you go to a barber and they cheated on you with another barber, like, but ultimately, can you tell if someone gets massaged often versus not?
Yeah, for sure. I think there's always exceptions to every rule and every person. Some people are just born naturally very at ease in their body and able to open up and be vulnerable, and other people are not able to feel that. But normally, a person that receives massage frequently, they're used to the norms, they're used to the boundaries, they're used to the touch, and they're used to being in that position, of vulnerability, being open, and they feel safe and comfortable already in that position. Whereas somebody that's new, maybe they feel more constricted, a little bit, less safe until they get used to it, right? So then somebody that's been massaged a lot in their life, you can feel that they receive the touch, that they're able to use their breath more readily. They're able to connect with their body more. And then there's some people like athletes or even actors or people that are body workers themselves that are very connected to their body, and they are able to also just be at ease on the table. So it's not only receiving massage, but people that are very connected with their physical body. Some people, their jobs are so cerebral, and the whole day they don't even connect with their body. They don't even, maybe only in the moment of eating or going to the washroom that they actually feel their body. Some days they're on the computer, sitting down at a desk for hours on end, not even being present in their body. So sometimes for those people, coming here and, being in their body, feeling their mind is very active and it's kind of takes over. So it takes some getting used to feeling the body, being concentrated on that for 1 hour. It can be a lot, but it's very beneficial for this kind of person because it allows them to have a balance of energy, right? And to feel the body, to bring energy into all corners and areas of the body. So at the beginning interview, you had spoken about the ribs on the left side. So after we finish here with a little bit of acupressure on the neck and head, I can actually work over the blanket and we can do a little bit of abdominal massage called ampuka.
Okay.
So it's a Japanese form of abdominal massage, which will incorporate the area of the diaphragm and the ribs. We've never done ampuka before, so it'll be nice for you to try that if you feel comfortable.
Please,
You
yeah.
feel comfortable? So then I'll do something called rib raking, which is pulling between the ribs gently to create space and just see if maybe the tension or pain that you're feeling in that area is maybe because it's constricted. You know, maybe you did a movement that kind of tightened the muscles of the intercostal muscles, which are the muscles in between the ribs. Costal means ribs, it's the anatomical term. So the muscles in between the ribs, intercostal. So we'll try to touch those and bring some warm, gentle touch just to relax those muscles and see if you feel any relief. Sound good?
Yeah, that's exactly what I was thinking.
You thought ampuka.
Yeah.
So this is actually a technique that I learned in a conference that I went to in Pennsylvania, a shiatsu conference. And I learned it from two wonderful Italian ladies from Milan that are shiatsu therapists, and they do a lot of ampuka. So a big breath into your belly. We're going to traction the cervical spine gently and exhale. So this is just bringing a little bit of pull into the spine to lengthen and help relax the muscles of the neck.
Breathing wise, I always think I'm not doing breathing. Can you direct me and the viewers
Yes.
on breathing? When
So
you say
this is
breathing,
probably
what's the best way?
the single most important thing that we can transmit to the people that are watching. Breathing is so important. So when we're breathing, we want to fill the abdomen on the inhalation. So if you notice, when I ask Trevor to breathe in through his nose, his belly is going to rise and fill. Because the lungs are filling, the diaphragm is going to push down into the abdominal area and it's going to force the abdomen to lift. Okay, so breathing in, belly rise. And as you exhale, it lowers because the air is coming out. And then I engage after about 1/4 of the exhalation is already let out. And we'll do it again, breathing in. The predominant movement is in the abdomen and not in the chest. Exhale. Sometimes I even ask people to put their hands over their abdomen so they can feel the rise and fall of the belly. And exhale. So some people also call this deep diaphragmatic breathing. So you can even search, YouTube videos on how to practice this. There's probably some guided videos also, and this is an excellent practice to have and to get used to coming back to breathing like that, because when we're born, all babies breathe like this. If you watch a baby, they breathe with their belly moves with their breath. As we become older, as we have more patterns like physical patterns. So I'm going to touch over your belly. You're okay with that?
Yes.
Then we start to breathe more apically, which means the breath comes more into the chest. And this has to do with, having the energy be in the heart and in the head and less grounded, less into the bottom of the body. So what I'm doing here is I'm just gently doing a clockwise movement in the belly, just to bring the person's mind into the belly. And there's so much happening in the abdomen. All of the organs are here. All of the nerves pass through here. Some would go as far as to say that this is like the second brain of the body, the digestive system. And then I start to move the hand outward, so to open up the muscles and the body, the rib cage and the diaphragm. And slowly, with my breath and with the client's breath. How does it feel, Trevor? So the slow movements allow a person to feel and to get there first with their mind and then with their body. So without giving a person time and space, they're not going to feel the whole range of sensations. If we go slow, we allow for that feeling. So we're working here around the hip bone. And for some people, this can be a little bit uncomfortable. It's a sensitive, very vulnerable area. It's soft. It's close to the genitals. So it's important to communicate with the client if they feel comfortable, and to make sure that the boundaries are respected.
Talking about boundaries, you did ask before you started this process, you're doing this over the sheet. Is that for privacy or for technique or both?
So ampuka, because it's a shiatsu technique, can be done over the clothes. And for somebody that's never received abdominal massage or massage over the chest, it's like an introduction, right? So then it just allows the person to feel more comfortable. Maybe on a second treatment, doing the same kind of technique, then we can say, would you like me to work on the skin? And then I would drape the chest, independent of it being a man or a woman. In massage therapy, we're not supposed to expose the nipples. So then the person would be draped up to the hip bone with a towel over their chest. And then we would work on the indicated area. I'm trying to feel in between the ribs and try to pull the fingers through that space.
Do you feel anything? Like if I didn't even say that I had,
No.
obviously it's right for me to say I have a pain, but can you see it or feel there's a bruise or anything interesting?
Especially over the sheets, it's a little bit, over the blanket, it's a little bit more difficult. From here, I can't really feel. Sometimes by pressing the ribs or the diaphragm, sometimes we can feel if there's any restriction. Sometimes I can try to put some acupressure with the tips of the fingers underneath the lowest rib, and I can feel.
You can be a little higher now that I think.
More
right
under
here,
the
right
chest.
where my hand is.
Mm-hmm.
There.
So it's not down close to the diaphragm, it's higher up to the chest.
Yeah.
So sometimes people think that, a pain or a tenderness is only associated with an injury. But the work that I do in shiatsu, in yoga, it teaches us that we have meridians, which are like energy highways all around the body. Every single part of the body has nerves and energy pathways. And they cross over. Sometimes they're the same, sometimes they're different, sometimes they merge. But there's a constant flux of energy in these pathways. And sometimes, depending on our emotions, on our experiences, on the seasons, on our sleep, on what we eat, the energy in these will move, can get stuck. So sometimes that's what we're feeling. When we feel a pain or tenderness, it can be, a little stuckness, almost like maybe a traffic jam in one of those highways. And just bringing attention, bringing a warm hand to that area sometimes can, open it up a little bit and can help to just release some of that energy or tightness and allow for the flow of energy to be more harmonious. So it's like moving traffic through a bottleneck or opening up one more lane, and all of a sudden things are moving better. Stretching can also do this. So I'm pulling the hands away from each other, pulling the diaphragm and ribs down and the shoulder away. Can open some space up where Trevor is feeling that tightness. And while I'm working, I'm always trying to notice what the client's breath is telling me. Do they feel comfortable? Are they feeling pain? Is the breath becoming constricted, faster, slower, deeper, more shallow? And then also noticing how I feel within that and what's happening with my breath. Always paying attention only to the client. I always keep coming back to myself and asking myself, how do I feel? Am I being present with this person? And even if I'm not present, even if it's not a judgmental thing, it's just noticing. And just by noticing, then, I'm at least being conscious of that. And then I allow, it to be whatever it has to be at that moment. I feel like there's a little pop there, right?
That's a good thing, right?
Yeah, because I'm not putting a lot of pressure. So the way that the ribs rest into the sternum, they kind of have little grooves where they sit. And sometimes we can make a movement that maybe, it just kind of comes out of a little bit. So maybe what you just felt, maybe the rib kind of just went into its little spot again. And see, the work doesn't have to be rough or deep or hard. It's kind of just almost like dancing with the body and just saying, okay, like if you want to do something, just go back to where you need to go, right? Really, I feel like it's almost like dancing. You can't force somebody to dance. You can't force somebody to listen to you. The only way that we can do that is by being gentle. When the body opens up, when the person trusts you, then you can go deeper, you can use more force. But you need to start by listening, by seeing the person, by making the body feel that, like, my fingers are really trying to feel your body and really trying to understand what's happening here. And then that relaxation will, by the muscles relaxing, if you think about it, the muscle is opening up, then that bone can go, oh, I'm back, right? But if I was trying to force it, the muscle is going to be tight and the bone won't go anywhere.
Right.
And I feel like, nowadays everything is kind of very active, very, not forceful, but maybe forceful is the word, I don't know. But there's no time given to just being slow. So we're just going to end off with a few more minutes here on the head, neck, and shoulders, and we'll work a little bit with acupressure on the face, which is very relaxing. Some of my older clients will even refer to it as the natural facelift. But it's helping to bring circulation into the face. So I'll wipe some of the oil off of my hands, and then I'll come to the forehead. And just opening up the forehead, sliding the hands down. So again, when there's so much energy in the brain, in the head, just bringing the hands onto the head, onto the third eye, the point between the eyebrows. And then it kind of calms everything down, smooths all the energy out. And most people find this very soothing, very calming. How do you feel?
Amazing.
And the touch is very gentle, it's not intrusive. So it kind of eases itself into the person's body and energy. It's not forceful. So there's a lot of acupressure points on the face that are very soothing and that kind of connect directly into the brain. One of them specifically is here on the inner edges of the brow bone. So I place one finger underneath the brow bone and one above, and it's very deeply soothing. It's almost penetrating into the middle of the skull and brain. And some people are very skeptical of energy. But what I love about shiatsu is that if you just allow yourself to be open to it for a few minutes, that it will prove itself to you. It will show itself to you. I've met very few people that weren't able to open up and feel the power of these points, especially on the face, the ears, the hands, and the feet. It's very powerful. So sometimes when I'm doing this work of acupressure, I'll notice the person's breath deepening, slowing down. Sometimes they sigh. Maybe if they were fidgety during the treatment, then all of a sudden they become very still, very calm.
Have you had clients just fall asleep for the 100% whole treatment?
Definitely.
And are they still getting the benefit?
Sometimes more benefit because they're not interfering, right? They're just totally open and allowing me to do what I need to do and allowing the body to do what it needs to do. Our body has an innate knowledge and knowing. And some people, I just touch them and they're already, and I like it because I can just work and, can just not being almost watched, the person is not interfering in the process. But like I said, every treatment is exactly what it needs to be, and I really trust that. After so many years of working with people, I trust in the process. I respect the boundaries, the rules, and then I let the rest kind of unfold. Whether it's talking, whether it's sleeping, whether it's crying, whether it's laughing, confiding, whatever needs to happen will happen. As people become more skillful in their professions, there's always this kind of ease or flow that comes in. So when you find that, it's a very nice thing to feel and to engage in. But it takes time, takes confidence, takes trust and respect from both the therapist and the client. So I find, the more people come, the more benefit, the more in the flow you can be with the therapist and the client. So we finish the treatment with massaging the ears, and then coming to the tip of the head and doing 3 acupressure points to release the energy and kind of just instruct the body that this is the end of the treatment, and it kind of just seals everything off. I let the person know that we're finished, that I'm going to be leaving the room. I give them a towel so that they can wipe off any of the excess oil that is on their body. I always leave some tea or water for the person to drink after the treatment, and that just helps to keep them hydrated and to ground them. And then when they're ready, they can get dressed and leave the room.
Thank you for this.
Sheila, that was great.
Wonderful. I'm glad you're feeling good.
Before we wrap, I just wanted to ask you, what's one small thing people can do daily to reconnect with their bodies or reduce tension?
I think during the treatment, we practice some of that deep diaphragmatic breathing. So whether you're having a stressed moment and you take a moment and just have a few deep belly breaths. So bringing your hands onto your belly and breathing deeply, not so much in the chest, but deep down into the belly, and expanding and exhaling. But you can also do this when you wake up, like 3 to 5 deep breaths before you go to bed, 3 to 5 deep breaths. Again, focusing on expanding the abdomen on the inhalation and exhaling, letting the air go, the belly comes down. For me, breath is 100% the most important thing.
What's a good question someone should ask when they're trying to pick the right massage therapist?
So I think you have to get to know and try many different massage therapists. So even when you come into the space, how do you feel? Always asking yourself, how do you feel? Do I feel good in the space? Do I feel good? Do I feel seen by this person? When you ask questions, how are you received? Are people listening to your questions? Are they trying to answer to the best of their ability? If they don't have the answers, or if they don't feel that they can serve you, are they referring you to someone else or giving you other options? I think the feeling is always what we need to come back to. So how do you feel in the space? How do you feel in the presence of these people? And then, maybe you need to try a few different therapists and just see how you feel after the treatment, during the treatment. So yeah, feeling, even for myself, I try to always come back to that. How do I feel in every moment? And I think, lots of people say that when they come into this space, when they talk to us, they feel seen, they feel heard, they feel comfortable. This is not like a sterile kind of clinical setting. It's almost like being at someone's home. If you go to Aaron's house, it looks exactly like this. And there's lots of personal touches. There's lots of natural, organic feeling, elements and decoration. And it kind of feels like home. So everybody is different. Some people don't like that, but every person needs to find their place. There's no right or wrong. You just need to feel it out.
Thanks, Sheila.
Thank you. This is fun.